Hi Larry, what is trauma?
Well, trauma is something we think about with anxiety and with stress, but it's basically something that is very bad, that is out of the ordinary, that a person may have experienced or may be experiencing on an ongoing basis. When we look at what the Diagnostic and Statistical Manual, 5th edition, which is the one that we're using now in the field of counseling and therapy, trauma has been more narrowly defined. It's basically a life-threatening situation for that person. They have been in some sort of a circumstance where their life was threatened. Or another person close to them, or one that they witnessed, that their life was threatened, or possibly they lost their life. Or if somebody has been through a sexual assault, or I guess you could say a very serious physical assault. Or if a person works as a first responder, which would be like firefighter, police, ambulance workers, who are encountering lots of trauma experiences, or therapists and counselors who are listening to people tell their trauma accounts as a part of therapy, but it's not just hearing one, they're hearing it over and over again as a course of their work. So that can be what they call vicarious trauma. So when we think about what's not trauma, other kinds of bad things that can really have an impact on a person doesn't really count as trauma anymore, but it may result in many of the same symptoms that trauma does. So if we just, again, going back, what are some of the kinds of trauma we're thinking about? You know, maybe somebody has been threatened in a robbery or holdup. Maybe they were near a place of civil disobedience and their lives were threatened. Somebody was intentionally trying to kill them, for example, in a war situation, or where they've witnessed something else. It may be where somebody actually watched a car accident happen and they saw a person get seriously injured or killed, especially if they went up to the vehicle afterwards. Then that is traumatic. Or if, again, if somebody went through a rape or severe domestic violence where there's ongoing physical threats. And so those are kind of the main things we think about with trauma.
All right, thank you.